Welcome, everyone, to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This is a series run by the Division of Forensic Behavioural Sciences of the University of New Mexico's Department of Psychiatry and Behavioral Sciences in support with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo. I'm the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, make sure you enter them in the Q&A box. Anytime you feel comfortable, do know that we hold questions until the end, and oftentimes it's not possible for us to get through all of them. If you are pursuing continuing medical education credits, there will be a sign-in sheet posted in the chat box shortly. If you are pursuing APA continuing education credits, the link for that will also be in the chat box, but near the end of the hour. So keep your eye on the chat box in the last 5 to 10 minutes of the presentation. Make sure that you bookmark or copy the link if you're not going to open it before the end of the webinar. And after you complete the survey, make sure you save a version of your survey certificate because we don't have access to those after the fact. If you missed last week's talk in the series, Dr. Jamie Anderson's eye-opening discussion of alternative assessment considerations for psychopathy is now available on our YouTube channel. The recording for this week's talk should also be available on our YouTube channel later this week, and the PowerPoint slides will be accessible for people that have registered for the series later this week as well. As a heads up, next week we have Dr. Terrell Taylor, who will be discussing addressing criminal legal stigma to increase mental health wellness and help seeking. But circling back to this week, I'm very excited to introduce you to today's speaker, who will be discussing recognizing and assessing stalking. This is Dr. Troy McEwan. Dr. Troy McEwan is a professor of clinical and forensic psychology based at the Center for Forensic Behavioural Science, Swinburne University of Technology in Melbourne, Australia. She's also a principal psychologist at the Victorian Institute of Forensic Mental Health, Forensicare. Since the late 2000s, Troy's research has focused on understanding, assessing, and responding to problems behaviors like stalking, family violence, and fire setting. She's the co-author of several internationally implemented risk assessment guides for family violence and stalking, and recently co-authored the book Treating Stalking, which gives detailed and evidence-based guidance for practitioners working with this client group. She's past president of the Australian and New Zealand Association of Psychiatry, Psychology, and Law, and she sits on the editorial boards of Criminal Justice and Behavior, Journal of Family Violence, Journal Threat Assessment and Management, and Psychiatry, Psychology, and Law. So Dr. McEwan, Troy, on behalf of the University of New Mexico, thank you so much for joining our series, including how early you're getting up in the future on the other side of the world for us. And we're very excited for you sharing your expertise with us today. I'll go ahead and toss it over to you.
Thanks very much, Anthony. I really appreciate it. And thanks everybody for coming. I'm going to warn you, I'm slightly still asleep. It's about 5 o'clock in the morning here, so apologies if there's a random yawn occasionally. I'll try and hold it in. So just as Anthony said, there's some CE kind of things. I'll show a QR code at the very end that you can use to get to the APA one. Couple of disclosures just to start with. I'll bring this up during the actual talk when it's relevant, but just to highlight, I am going to talk a little bit about stalking risk assessment in this presentation, and I actually am a co-author of a risk assessment tool for stalking. So I don't actually have any financial interest in the tool, but I do get money for training on the tool. So I'll point that out when the conflict of interest kind of arises. I'm not employed by UMN, so my views are not their views. So that's a nice disclaimer. So just to kind of kick off, I'll just start by kind of explaining a little bit where I am. I actually am right now where this photo is. So the Yarra Valley in Victoria, it's Wurundjeri country. And so I'd like to acknowledge the traditional owners of that country and pay respect to their elders, past and present. Pretty much that's where I live right now. It almost looks exactly like that. The sun is actually not even quite rising over the mountains. So yeah, it's early. All right. So what our goals are for this hour is to achieve these three things, hopefully. I'm aware there's going to be probably a wide range of experience with stalking in this room. And so the first thing I want to do is kind of describe what it is and deal with the fact that it's kind of, you've got to recognize it. It doesn't kind of point itself out to you. And I'll talk about some of the issues around that. So describe that, help you to kind of think about how you can see it when it's presenting in your practice. I'm then going to talk about some potential reasons that people stalk and then, you know, maybe some reasons psychologically what might be going on that drives stalking that can maybe help when you're looking and thinking about assessment, thinking about formulation and thinking about treatment planning and maybe intervention for some people. And then finally, we'll finish off by talking a bit about risk assessment in stalking, kind of a bit of a review of where the literature is at in terms of risk factors and like what the risks are, what kind of evidence-based risk factors are. And then I'll talk briefly about the 3 structured professional judgment guidelines that are probably recommended for use in stalking cases, and kind of the pros and cons of each in that context. And that should take us through the hour, okay? So let's start off then by talking about recognizing stalking. You know, like what is this thing that we're talking about? It sounds like maybe like a slightly silly thing to start with, like stalking. Yeah, of course, it's fine. But the reality is that one of the biggest challenges when working in stalking is the fact that most people don't know what it is, and most people don't see it when it's in front of them. So starting off with a bit of a definition, there's obviously lots of different legislative definitions, and I imagine the audience is from right across North America, maybe externally, and you're each going to have a different legislative definition of stalking, and they can be quite different. So it's really important that you do understand what your legislative definition is, and so if you are seeing someone who's charged with stalking, what that actually means, because it can be different in different jurisdictions. But in terms of a definition that we can use to inform our clinical practice and how we think about this behaviour and the people who use it, this definition here is quite a useful one. The key kind of words to focus on are the fact that the behaviour is a pattern of repeated behaviour. So one behaviour does not make a stalking episode. It has to be a course of conduct. That might mean just 2 behaviours, but realistically, in most cases, it's going to be a lot more than that, and it's going to persist over greater time. The other really key kind of concept in this definition are that the behaviour must be unwanted. Right? So this idea of unwanted intrusion, you're pushing your way in where you're not wanted, and that's what makes it a stalking episode. Often when I'm training kind of lay people or police, I use the analogy of, if someone is coming to your house, delivering flowers, and maybe texting you and calling you, and you want them to, you're probably dating them, right? If you don't want them to, they're potentially stalking you. Okay, so the wantedness of the behavior, the desire on the part of the recipient to receive that behavior, is really crucial to the definition of when stalking is present. And the third element to that definition, which is necessary and important, which is that it causes the target or targets. In many cases, there's often primary and then secondary people around them who are also being targeted. It causes them reasonable distress or fear. Okay, so it's got to have a negative impact on the person of some sort. We don't use just a fear standard because it excludes a lot of genuine stalking victims who may not be fearful, but they're very, very distressed and experiencing substantial psychological harm. So that's our definition. That's the kind of concept that I'm talking about today, and we're going to come back to elements of that throughout. Really importantly, a couple of things just to remember when we're talking about stalking, which is it's a behaviour. It's not a mental disorder. It's a behaviour. It's a thing people do. It is formed from the sum of its parts. It doesn't exist without the behaviour. It requires behaviour to be present. We only see stalking when there is this pattern of behaviour. It's really varied, and I'll talk more about the kind of different kind of motivations and contexts in which stalking arises, but it's important to recognise that it is very varied behaviour, and there's lots of different reasons that people stalk, and so kind of you can't come in with one kind of assumption of what's going on. A really key element of stalking that differentiates it from many other problematic and criminal behaviours is that the behaviour itself is defined by its persistence. It only exists in its repetition and in its persistence over time. So most behaviours that we work with, like harmful sexual behaviour or violence, the person might be violent repeatedly, but usually it's towards different victims in different contexts, obviously family violence being an exception to that. But in stalking, what you have is a targeted pattern of behaviour that persists despite the absence of other relationship to the victim. Okay, so you get this kind of ongoing, relentless pursuit over time that is sustained, certainly situationally to some degree, but also by what's going on inside the person that sustains it. And for us, for me as a psychologist, that's a really interesting phenomenon of like, why does that happen? What is the persistence? And I'll talk briefly about that today. And the final thing I'm going to mention is that most people who stalk are not charged with stalking. And that's a really, really important thing to be aware of, because it means that in our work, you have to be thinking about, hey, is this stalking, when you're assessing somebody, because likelihood is they're not going to have a stalking charge when they present to you. So you might have to see the stalking and say, actually, this is stalking, and that's important to how we understand this series of assaults or these threats or whatever it is. Right. So what does that actually look like? I mean, I've talked about the idea of persistence and a pattern of repeated unwanted behaviour. And when it really can be any behaviour. Stalking does not require a specific thing. We in the field often talk about communication behaviour, contact, and then other things purely as a shorthand, but it doesn't have to be any particular combination. The most common stalking behaviour is phone calls, still, despite cyber stalking, social media, by far the most common stalking behaviour still is phone calls. And most people who stalk will attempt to have direct communication with the victim. It won't all be kind of surreptitious following and stuff like that. That does happen, absolutely. But for most people who stalk, it has a communicative function. They want the victim to know their presence and what they want. They're trying to get the victim to do things. And so that communication, it's kind of often a very key part of stalking. Sometimes threats and physical violence are discussed not as stalking behaviours, but as things that kind of somehow happen that aren't stalking, but happen in stalking. It's kind of a bit odd, to the point that actually, interestingly, in the US, epidemiological survey of stalking that is done periodically, they actually don't report the prevalence of violence. It's within stalking, like by the person stalking towards the stalking victim. It's really quite strange, because physical violence and explicit threat are a really core part of stalking. And obviously, a form of contact can be physical violence. A form of communication can be threatening. So I'll talk more about violence when we talk about risk assessment, but it's really important to recognise that, kind of explicit acts of aggression and physical violence specifically are actually quite common in stalking cases, and they form part of a stalking episode in lots of cases. One of the challenges with stalking is that so many of those behaviours on that previous screen are actually just normal behaviour, right? It's not inherently problematic. It's the context in which it occurs, the way in which it's repeated, and the effect on the victim that makes it a problem. So it really is a continuum. There are cases that are very clearly stalking, and anyone would say that it's stalking. And then there are lots and lots of kind of grey cases where it's like, oh, I'm not quite sure. This seems maybe like it might be more normal. Maybe the victim has had some return contact, or maybe does that make it less problematic? There is lots of grey in stalking, and this is one of the reasons that in the criminal justice system, stalking doesn't get called stalking, because it's easier sometimes, I think, to call it other things, or it just doesn't get recognised as stalking. The things to think about when you're trying to make that decision about, is this stalking, is what I'm seeing kind of, if you like, crossing that threshold into an abnormal and potentially criminal, certainly harmful behaviour, are these kinds of factors. So think about how long the pattern of behaviour has gone on for, in the face of clear messages that they shouldn't be doing this. So they're failing to respond to feedback and to indications from the victim, but maybe from others, police, courts, that their behaviour is unwanted and they need to stop, but that doesn't stop them. As you get into stalking, you get these intensifying emotional states, like really intense, dominant emotional states, where the person is really overwhelmed with their emotions and with the thinking that comes with those emotions. It becomes, really dominant in their life and in their mental, internal life. And often over time, it actually dominates their external life as well. And they start to withdraw from other aspects of their life. Once you get into stalking that goes for months or even years, you see kind of a reduction in that person's functioning overall as well. And then obviously, key thing, as we've already discussed, is if the pattern of behaviour is causing the target fear or distress, you've got to kind of think, hey, this is potentially stalking. If you're seeing a behaviour that has attracted police attention, the victim has gone to police and said, this person is doing these things, I'm getting these phone calls, they're at my house, it's freaky. you can assume it's caused them some level of fear or distress. They've gone to the police. Most stalking victims, it takes them something like 80 or more unwanted contacts to contact police. By the time they get there, for most stalking victims, it's already been going for a long time. So think about those kind of things when you're trying to think about, is a behaviour stalking or is it not? These are some of the things you can kind of turn to. In terms of prevalence, it's a really common behaviour. These are some stats from the various national epidemiological studies. I've just picked out 3. There's others from other countries. You can see there in the US, for some reason, the lifetime prevalence for women is a bit higher in the US. I think there's probably reasons you could think about as to why that might be, in terms of cultural factors, perhaps in terms of things like rates of intimate partner violence and how that translates into stalking after the end of relationships. So I think that there's maybe some reasons for that, but broadly you get fairly consistent figures like this. As you can see, it's a gendered behaviour, so this is stalking victimisation. So more women are victims than men. In terms of incidence, so this is annual incidence, again, from those same studies. The American study, it's actually the same data set. It's just a different set of analyses by different authors. But you can see you get slightly higher prevalence for women, interestingly, in the UK and in Australia, and this is slightly lower for women in the States. Again, I kind of can't work out in my head why that is. I thought to start with it was to do with different definitions that were being used, but I had a closer look and they're fairly comparable, so it's probably not that. It could be definitional issues, but it might not be, so I'm not quite sure. But regardless, what you can see here is that, if you think about the population of the US, or UK, Australia, you're talking about many, many hundreds of thousands, if not millions of people every year being stalked. Yeah, so it's a really quite common experience that isn't perhaps recognised as being as common as it is. These studies are all quite good in how they measure and define stalking. I think with respect to the English, I think the Australian and US studies are slightly better. I think the English study, the way they ask the questions is maybe not quite as good, but they end up getting quite similar results. So it's all much for muchness. It's important to point out that at least in the USA, women and men who are of minority racial backgrounds are stalked more frequently. So this is data from Smith's study. This is actually data from a 2016 national survey, a really big epidemiological survey of violent experiences. And Smith did some analyses just a couple of years ago that were published. So you can see there much higher rates of lifetime prevalence. So compared to 30%, excuse me, for women overall in the States, it's 54% for multiracial women, 43% for First Nations women. So we've really got much higher rates. Similarly for men, about 7% in the States for men overall, 30% for multiracial or First Nations men. So it's just worth noting that there are cultural differences in the experience and frequency of stalking. There's some data from Canada that suggests similar. We haven't got equivalent data from the UK sorry, not from the UK, apologies, from Australia. We don't, the way that study is done, there's not enough First Nations people in this particular sample to separate them out as a group. So that data isn't there for Australia, so I can't talk about that. If you think about the context in which stalking, oh, there's my first yawn, sorry, very early still. If you think about the context in which stalking first occurs, it comes out of a range of different relationship types. I think there's a misapprehension that most stalking occurs in the context of intimate relationship, and it's just not true. They form the single largest group of stalking victims, so people who've had, as it says there, a current or former relationship with the person who subsequently stalks them. It's worth noting that there are kind of different ways of approaching stalking. Some definitions include behaviour within a current relationship and some don't. The stalking specific literature tends not to. The intimate partner violence literature uses the word stalking to mean particular behaviours within an abusive relationship, so specifically monitoring and spying often. So you need to be aware of that nuance when you're reading this literature. In the big surveys, like in this kind of Big Smith survey, when they do report the difference between current and former, you actually see that the vast majority of people in these surveys who are reporting being stalked are being stalked. 70 to 90% of them are reporting behaviour by a previous partner. So in this particular group, 70 to 90% is former partners, depending on the study. So it is predominantly, even if you use a broader kind of term, it's predominantly a behaviour of former partners. But that said, acquaintance stalking is actually the most common stalking behaviour or someone stalking context. Okay, so you can see in the literature, you would typically include people of authority and brief encounters in that acquaintance group. And in some places, we actually include family members in the acquaintance group as well, which is a little odd, but they're just different to intimate partners. And then strangers are quite a smaller group. So this is out in the community and epidemiological kind of research with stalking victims. When you look at a kind of a meta-analysis. So Brian Spitzberg has, over the years, he's published a few meta-analyses of stalking studies and just looked at kind of big, broad patterns. And this comes from one he did in 2014 and just looked at general population and those same three relationship groups, ex-partner, acquaintance, including family, and stranger. And you can see there that it looks quite similar to those data from Smith. Yeah, it's not a completely dissimilar picture. If you work in a forensic setting, it looks quite different. Okay, we don't see what is out there in the community. If you're a forensic mental health professional, so you're specifically working kind of in a forensic mental health context, in a secure hospital or something like that, you're going to see a lot more strangers and acquaintances and a lot fewer ex-partners, okay, because mental health is not distributed evenly. I'll talk a bit more about that in a sec. If you work in a general forensic context, like in a correctional probation kind of setting, or kind of like I do with people who stalk who come from all different kind of points of view, it's probably something more like this. There's no actual samples of people who stalk from forensic contexts that are general like that. That's part of the issue of not recognising stalking. They're not easy to identify in these systems. My best guess is probably that it looks something like this. So ex-partners are vastly overrepresented in these groups. And that's to do with the fact that they're more commonly physically violent. So they go into prison settings and these kinds of things more. And also they get caught up in initiatives about responding to intimate partner and family abuse. So they're more likely to get kind of picked up in those things in the general forensic system. So just be aware that what you're seeing is not what stalking is out in the community in terms of the prior relationships. Actually, ex-partners are not the majority of stalking cases. Just quickly, as I said, most people who stalk do not get charged with stalking. So what kind of charges might you be looking for? If you see any of these kinds of charges on someone's record and it's got these characteristics, so the same victim or group of victims over a relatively continuous period of time, so you've got a series of charges happening with that same victim, that's an indication that stalking might be present and you need to then look more closely, okay? So that most of the people I work with, that's how they present. They're not presenting with a stalking charge, and that's universal. We know that stalking charges are underused. Brady and Nobles, this is a US study that looked at the underuse of stalking charges in I think it was Louisiana, but it's universal internationally. Stalking charges are not well used. I can't talk about why because that's a whole different discussion. So if you're going to try and recognise stalking, let's say you see some of those charges, or perhaps the person just presents with an episode of violence or one or two acts of violence against a particular victim. These are some questions you can ask to kind of help you work out, is there stalking present? So looking for that pattern of repeated behaviour that is targeted towards specific victim or victims. Does the target want contact with the person who's having the behaviour, doing the behaviour? If they want contact with them, it's not stalking. It might be something else. It might be intimate partner abuse. It might be something else. But if the contact is desired, it's not stalking. Really importantly, though, there are contexts in which, let's say, an ex-partner they might have a legitimate reason to have some contact, for example, around children, but then there's not a legitimate reason for all their other contact because it's clear that they shouldn't be having that contact. And so that might still be a stalking case, even if there is some contact, and even if the victim has to have some contact with them for that particular reason. That sometimes does happen. Similarly, if you're a doctor or a lawyer and you're getting stalked by a former client, you might be obliged to have contact through a tribunal process, but any other contact is not warranted and illegitimate. So that still can be stalking. Okay, so just ways to think about these things. If we don't recognise stalking, it has lots of negative consequences. Most importantly, you're not going to actually do a very good assessment. You're not going to see the full scope of the behaviour. You're not going to appreciate what the risks are potentially, and probably any intervention that flows is not actually going to necessarily target the underlying drivers of that behaviour. So it's important that we see this behaviour where it's present, and we think about individual acts as part of a wider pattern where that is appropriate. Okay, so just to bring that bit to a bit of close, it's common. It's not going to be called stalking most of the time, so you need to be alert to it and looking out for it. And in doing so, you can make sure that your risk assessments, your assessment, your formulation is more appropriate and better targeted. That's your takeaways. All right, let's push forward then. Why do people do this? First answer is we don't really know. There's no kind of grand theory of stalking. That said, we do have quite a lot of information about who does it and some of the contexts and reasons they do it. So typologies have been a real thing in stalking literature. There's a lot of them. This is a particularly useful one. It was developed by colleagues of mine back in the late 90s in Australia. It's been quite widely used in a range of different settings. Basically, it just divides people who stalk into 5 types. This next slide is very busy. I'm not expecting you to read it. Okay, it's for future reference if you want to have a look at it. But just to give you a sense of how this works. So basically, each of the types is determined on the basis of a range of things. So the prior relationship, the context in which the stalking started, their initial motivation, okay, and then you get this sustaining motivation over time. And then I've just put the dominant emotions in because it's interesting. That's actually not part of typology. But so you can see that these 5 types are kind of determined on different kind of angles. Mental illness is also actually very important to this typology. I just couldn't fit it on the slide. So the kind of mental illness, particularly in determining the difference between the intimacy-seeking and incompetent pseudo-groups. The intimacy-seeking group is usually has quite a severe mental disorder, and so their love for the victim is actually pathological in some way, either usually delusional or perhaps complicated by severe personality disorder. Okay, whereas the incompetent pseudo, that's not what's happening. They're not kind of in love with the victim. They just quite like them, and they think it'd be quite nice to have a date or perhaps some sex. Thanks very much. And they stalk in that context. That's very different to the intimacy-seeking group. Okay. If you're interested in that typology, I strongly recommend having a look at this book. It's a really good book. It won the APA, Psychiatry APA prize for best book when it was published. It's a really, really good, thorough discussion of stalking, and it's going to teach you a lot of what you need to know if you're interested in the field, even though it's quite old now. It's kind of 15 years old. I've just talked about mental illness a little bit, and it's important to kind of think about mental illness because it's really common in stalking, particularly in stalking in forensic contexts. This is some work by Alicia Nigem-Jones, Barry Rosenfeld, Michelle Gallietta up in New York. They did structured diagnostic interviewing with a court-referred sample of people who stalk, mostly ex-partners. I think it's about 70% ex-partners, which affects your mental health kind of distribution because, as I said before, they've got less mental illness than the other groups. But that said, you can see, very high rates of personality disorder, substance use, and then a smattering of other things, with relatively few people having no diagnosis at time of interview. Importantly, if you divide those up by relationship type, you see a little bit of a different picture. So you can see over here, particularly with psychosis, that your acquaintance and stranger groups are overrepresented in psychosis, okay? And then personality disorder is a problem for everybody, as is substance use to a degree, and then mood disorder to a lesser degree. The ex-partner group are the group with the most absence of diagnosis, although interestingly, we actually did a study where we did data linkage and we looked at general mental health presentations to mental health, public mental health services for a group of stalkers. And actually the ex-partner group had quite a lot of historical contact with mental health service. They just weren't presenting at the time we assessed them with a diagnosable disorder. So there's still kind of mental health issues, even if there's not at that moment. Just as an example of maybe for psychotic stalkers, some of the kinds of things you might see, people who are psychotic often write letters. It's a particular thing, and usually you can tell they're psychotic from their letters. The one on the left is a letter that was sent to Queen Elizabeth. As you can see there, Mary believed that she was Queen Elizabeth's daughter, and she was writing to her mum, or her perceived mum, for some contact. The one on the right is a chap who was stalking the local police. and he perceived that they were targeting him, so he was stalking them in return. And you can see that there was some grandiosity and some clearly some thought disorder going on for that young man. So psychosis will present very obviously. It's not subtle, usually. You will see more delusional disorder in this group. Okay, so if you work with people who stalk, you will see delusions, so psychosis absent schizophrenia. You will see like pure primary delusion and overvalued ideas. And I don't mean that in the DSM kind of sense of the term. I mean that in the kind of proper psychiatry European sense of the term, which is, you know, a pathological fixation driven that emerges out of personality and is similarly dominant over the person's functioning as a delusion. It's just not a delusion. There is no theory of stalking, okay? However, some colleagues and I have done a bit of work talking about, you know, if you pull together the theories that have been used to talk about stalking, you can see some commonalities and there's some useful things you can draw out of that. This paper here by one of my former doctoral students, Ali Parkhill, kind of does that. So it's a good kind of reference if you're interested in kind of theories of stalking, and that it was a good critical overview of theory and then kind of a theory knitting approach at the end. But you can kind of think about stalking as a goal-directed behavior, right? And for most people who stalk who aren't psychotic, so the mental illness, the symptoms of mental illness aren't the core driver. There are a range of other drivers, perhaps complicated by the symptoms of mental illness. Really, it comes out of situations that are self-relevant. So it activates things that are central to their sense of self. You get strong emotions because of that. And then a strong desire for change. Like, you know, this situation is either not how I want it to be, or it offers an opportunity to make the world how I want it to be. And so you really, the people who stalk are trying to move towards a change in their situation, so it's different from what it is currently. Basically, some people will have individual vulnerabilities that make them more likely probably to respond with stalking and to make stalking behaviour seem like an effective way to achieve that goal. It's important to note that most people who stalk don't recognise their behaviour as stalking either. They see it as just, it was a phone call, it was a series of phone calls. They're not attaching the word stalking to their behaviour. So they often won't see it as, they don't even actually see the pattern so much. They see all the individual instances in a kind of disconnected way, in my experience, in a lot of cases. I'm doing some work right now, actually, with a student on kind of qualitative kind of work with people who've stalked to talk to them more about how they understand it and how they understand the fact that they've stopped stalking, what happened to produce that. So if we think about that kind of idea in a bit of a process model, if you like, essentially you start with a situation that is inconsistent with some sort of self or values relevant goal or desire, right? So this thing has happened and it challenges my sense of self, or it perhaps offers me the opportunity to achieve something that is very, you know, something I really, really, really want in my life, like a relationship or something like that. So that happens, you make judgments of that situation, you have causal attributions. Those things generate intense emotional states. You know, that's just general attribution theory, and you know, that's just general psychology. The strong emotional states are associated with a desire for change of some sort. Again, general psychology, that's kind of, you know, self-regulation theory. You choose for some reason to pursue those desires through victim-focused strategies rather than other kinds of coping or self-regulatory strategies. You know, so there's many reasons people might do that, but there's some reason that you choose to intrude upon the other person. And then if you don't keep going, you're actually not stalking. If you make one unwanted phone call, you're not stalking. If you exit at that point, that's not stalking. Yeah. So the emotion goes away, you stop responding to it, you stop behaving in this way, you're not stalking anymore. Okay. However, what we know is that people who stalk engage in a lot of rumination. There's often a lot of situational factors that maintain and continue to bring that situation to mind. So they stay in the situations, they keep having the emotions, they keep responding, and we go around and around and around in a circle. Now, for some people, there are going to be those individual differences that influence the kinds of judgments they make, the kinds of attributions they make, the kinds of behaviours that are in their repertoire that they choose. So, for example, more antisocial people are probably more likely to choose antisocial behaviour. Some people are more predisposed to rumination and to fantasy, perhaps. And then obviously for some people, just the situation around them is also a maintaining factor. So for example, my example before about shared children, shared children can be a real ongoing maintaining factor because there's this constant reminder of the problem situation that comes to mind and triggers off this kind of cycle. Right? This is just a way of thinking about it. I'm not suggesting this is kind of a really evidence. There's no kind of, well, there's some evidence for bits of this, but it's also just applying general psychological theories of human behavior and what we know about behavior generally to stalking in a way that's kind of can be helpful to think about. Like I said, that Parkhill paper kind of goes into some of this in a bit more detail, not so much in this kind of organized way, but talks about some of these concepts. It's really important to think about kind of cultural considerations when you're thinking about and assessing stalking, because culture operates at all these obviously in different levels. So it's going to affect the judgments people make, the desires and values they have, their expectations of others, what they think is appropriate behavior at the end. So at the individual level, all those psychological things are going to be influenced by their culture. And I mean culture, you know, in a broad sense as well as in a narrow sense, what they've learned and their learning opportunities. At the interpersonal level, you certainly get situations where there are wider cultures around the person that support the stalking. So some particularly conservative religious kind of cultures that don't support the ideas of divorce and that kind of thing, or separation, can actually support someone stalking their ex-partner to maintain or resume the relationship, for example. And then at the societal level, not every culture recognises stalking as a thing. So it's really important to think about what's this person's cultural background. Are they an immigrant who's come from somewhere where stalking doesn't exist as a concept? Because it doesn't in a lot of the world. So is that kind of important in how we understand what's happening in their behaviour? An interesting case, actually, if you kind of want to go back and look at it, most people here will be familiar with Tarasov as a case, the duty of care case in the States. It happened pre-stalking, so there were no stalking laws when Tarasov happened. But if you go back and look at that case, it's actually a stalking case. It's a stalking case that's complicated by delusion, but there's also some really significant cultural factors in that case that contribute to, I've just forgotten his name, sorry, the young man, the guy who was doing the stalking, contribute to his behaviour. So it's a nice example of a case where you've got this kind of cultural, psychological stuff, but also delusion and major mental illness complicating things. So, summary of that section in terms of why people stalk. Stalking comes out of a lot of different contexts. So if you see stalking, don't make any assumptions, kind of go in with an open mind, and don't kind of think, oh, it's going to be this or it's going to be that, because it might be a whole range of things. If you're unfamiliar with the stalking literature, I'd really suggest that you have a look at a typology like the McEwan typology. It's a nice heuristic or shorthand to help you kind of think about what might be relevant in this case, like what might be some important factors that I might be thinking about and looking for in this case. Obviously, typologies are limited. You know, they're not the be-all and end-all, but particularly if you're not so familiar with the stalking literature, they're sometimes a good starting point. Not all typologies are equal, not all as useful as each other. The McEwan one, I think, is particularly useful for clinicians because it has that kind of psychological bent to it and the mental health bent. If you're not a clinician, I'm not sure who's in the room, there might be some non-clinicians in the room. You can even just think about relationship type as a starting point. Like, you know, what kind of a prior relationship have these people had? And then what might that tell me about what's going on, you know, in terms of the potential for psychosis and these kinds of things. Okay. So mental disorder is really important. Most people who stalk, who come to the attention of forensic systems for their stalking, even if they're not charged with stalking, will have some sort of diagnosable disorder. Not always is that disorder driving the stalking, but often it's complicating the presentation. So the mood symptoms are making their rumination more so. You know, maybe they've got personality disorder symptoms that influence how they understand themselves and other in relationships, and that's really important to how and when they stalk and how they think about the victim, but it's not driving it. Where it is driving it, it's usually going to be either delusion or really very severe personality disorder where their interpersonal functioning is really very, very impaired. And that's really why they are stalking. It's more broadly, when you don't have those kind of core drivers that are major mental disorder, which in the most cases you won't, it'll be a wider range of things. It is helpful, I think, to think about stalking as a goal-directed behaviour. Yeah, it's a functional behaviour in the sense that it has a function. And the kind of strong emotional states and the overwhelming preoccupation, it's a response to those things. And it seems to be at least an attempt to change the situations that are like underpinning those emotions and that thinking. As you get into more persistent stalking of a longer duration, the importance of psychopathology becomes greater. If you hit a stalking case that's gone on for more than a year, it's a really good chance you're going to be talking to someone who's really been driven by some sort of major mental disorder, whether it's delusion, whether it's severe personality disorder, whether it's kind of an overvalued idea and a pathological fixation. That's quite, if you've got more than a year, like going, okay, there's probably something quite significant going on here, and work to rule it out rather than assuming it's not there. Basically, if you're going for more than a year, something's got to be sustaining it. Yeah, it just doesn't get sustained like that without there's something internal sustaining it. All right, so let's spend the last little while talking about risk and risk assessment. I'm going to kind of scoot through this a little bit because there's a book chapter that I'm going to refer to that you can read it all. So get the book chapter and read it. You don't need me talking at you to tell you. The biggest thing I want you to remember out of this is that risk in stalking is not just the risk of violence. The risk of further stalking is really, really important. Okay, and actually in some ways more important than the risk of physical violence because actually it's more common. So risk of further stalking can involve two different kinds of outcomes: continued stalking of the same person or starting to stalk a new person. Usually they're mutually exclusive. A few people stalk multiple victims at the same time, but it's not that common. Most people will have one kind of target or group of targets that are related to each other, and then they'll stop that and move to somebody else if they're going to do that. We've talked about persistence a bit already in terms of duration. So just in terms of the risk, like a significant proportion of stalking cases persist for many weeks and months. Okay, so certainly upwards of 50% go for more than a month. Yeah, absolutely. And many go for longer than that. So persistence of stalking is a real problem. And so that risk of further stalking of the same victim is a real concern. Men and women stalk slightly different durations. It's similar-ish, but women tend to have a few more women stalk for longer when they do stalk, remembering these aren't even examples. There's many more men stalkers than women stalkers, but when women do stalk, more of them stalk for longer. That's because there tends to be more major mental disorder amongst women who stalk, psychosis and severe PD. In terms of recidivism, there's a few studies. This is literally all studies who've looked at continued stalking of the same victim after criminal justice involvement, so after police or even court involvement. They use different kinds of measures of future stalking, which is why you get this kind of variation. So our study, this first one from 2018 in Australia, we used a stalking charge. So it's the most rigorous thing. But remember, stalking charges, not used that often. In the States, these guys used just any known contact. So the police were aware that there was any known contact after the initial police report. And so that's much higher. And then a range of different ones. A Dutch study, we used police report in that one as well, a short follow-up time, noting we only had a 6-month follow-up time in this study, but we still managed to get a 40% recidivism rate, right? Versus this study, which is also Dutch, but done in a very different context. This was in a police context. This was a forensic mental health context, community forensic mental health. We had a much longer follow-up time, but still 40%. Okay, so it's an interesting kind of, most of the continued stalking of the same person actually occurs quite quickly, it would seem. Canadian study, secure forensic mental health. So you get lower, probably less opportunity to some degree in this sample. And then this is some work we've got in process at the moment, which is a really long-term follow-up of a sample of about 220 people who've stalked, and we're doing very long-term police follow-up. Again, you can see you don't get massively higher rates despite the very long-term follow-up. It's something that happens fairly quickly if it's going to happen to the same victim. There's a range of research. The risk factors we're really kind of sure of are these kind of psychotic delusional things. There's pretty good evidence that that's associated with increased persistence, as I've already suggested. People who are unwell often send gifts. That's why this is a good risk factor, because they closely relate to each other. There's a range of other things that are identified in the literature, but with less kind of consistent results, or perhaps even contradictory results. So a bit more to do. This is the book chapter I referenced. It will be at the end in the recommended readings if you want to get a hold of it. It's a kind of a pretty up-to-date review of the literature on risk in stalking. Stalking of a different person, there's fewer studies that have been able to actually differentiate. There are other studies of stalking recidivism, but not that can differentiate same from different victim, and it's quite important because they are quite different. So you can see here the y-axis is not as tall, so don't compare those two graphs, they're different. But you can see here that we do get, in this study we have at the moment with a very long follow-up, we do get a higher rate of stalking of a different victim over that very long follow-up than you do over the shorter follow-ups. Okay, so but still, you know, relatively, you know, kind of 1 in 7 up to 1 in 3 in this very long follow-up time. We know much less about specific risk factors for stalking of a different victim because there are very few studies that are able to look at it. Certainly a history of stalking someone else, unsurprisingly, is a risk factor for stalking someone else in the future. Personality disorder seems to be quite important. There's logical reasons to think why that might be, going back to the model I've just kind of talked about. And then maybe other criminality might also be an indicator, but there's less consistent findings. Just to emphasize, this is from that Bridgman study that I've said it's in prep. This is just a survival curve. As the thing pops up one level, that's someone having a stalking report to police, okay? So you can see that stalking of the same victim, 75% of reports are happening within a year, whereas for stalking of a different victim, only 25% of reports are happening within a year. So just emphasising the speed of that continual ongoing stalking of the same victim. Often it seems to, even though the police have been involved, there's been a charge laid in this particular sample. We're actually looking at police reports that potentially led to charge. Despite that, you still get, you know, 75% of people have another police report within a year. Yeah, so criminal justice interventions are not particularly effective, is what I'm saying. We need to be doing other things. I'm not going to talk about treating stalking in this workshop because I don't know this seminar, there's no time, but we need to be doing other things. Very briefly on physical violence is the other big area of risk. Obviously, people are concerned about. It's important to think about physical violence in stalking because threat is so ubiquitous and they're already being stalked. They're worried about, are they going to get hit? Yeah. So when we talk about risk of violence in stalking, we talk about the risk of physical violence, not as kind of aggression or general kind of threat kind of things. It's a much narrower construct. The orange studies are community epidemiological studies. The red studies are studies that have been done in forensic samples. Okay, so you can see that there's a bit of variation in the community epidemiological studies. The dressing study in Germany, which has that very high prevalence, I think it's because they had a sample bias. I think they probably got a sample selection effect in who responded. So they were getting people who were experiencing more significant stalking in their response to their study, whereas perhaps the Portuguese and Australian studies are less so. You can see here that I'm not quoting these big national surveys that I was earlier when I was talking about prevalence. It's because the big national surveys don't report violence as a thing that happens in stalking. I do not understand why. It's ludicrous, but they don't do it. So I can't, these are all studies that have been done by researchers who do have done epidemiological studies. The forensic ones, you see a fairly consistent kind of around 20%. You've got to remember that if people are engaging in significant violence, they might not be getting charged or identified as stalking. So we're missing kind of a swathe of violence at the top. These are all studies, both Barry Rosenfeld's in New York and ours in Melbourne, that are people coming through community forensic contexts. Okay, they're out in the community, they're not kind of in prison. There's a lot more research on risk factors for violence in stalking than there is on risk factors for further stalking. So we're pretty good on this and we know quite a lot about it. Some areas where there's certainly more to be done still, but we can be fairly confident of a range of risk factors. Just to mention severe stalking violence, because most violence in stalking cases is less severe. It's punching, kicking, bruising, you know, maybe a kind of a black eye. It's not more severe. There is, however, violence that results in very serious injury, serious sexual assaults, and even homicide. In the community forensic samples, you see about 5% of the violence is very severe. We've just done a study here in Melbourne looking at a sample of homicides, or a whole population of homicides from our state, and we've gone back and looked for stalking prior to the homicide. And what we found was that about 1 in 20 homicide cases had clear evidence of stalking. In the sample of ex-partner homicides, 63% had evidence of stalking prior to the homicide. And that's just from looking at judges' sentencing comments, like detailed judges' sentencing comments. Like, you know, so we're underestimating, undoubtedly. But you have to remember that that doesn't mean it predicts stalking. because the absolute vast majority of stalking cases that happened in our state over that time did not end in a homicide. So there is no predictive relationship between stalking and homicide. So just be really clear on that. And that includes for ex-partners. It does not predict stalking. If you're interested in that whole issue and that whole argument, please look at this paper. It talks about why people think stalking predicts homicide and the issues with the research that has found that, but it does not predict homicide. There are maybe some specific risk factors for severe stalking violence. Again, these two papers talk a bit about this. I don't have time to kind of go into it, but it is maybe a little bit different to general stalking violence. There are some particular things to be on the lookout for. So have a look at the Sheed study and the McEwan chapter. If you're doing structured risk assessment, there are 3 MAT tools you might use. You all would probably be familiar with the HCR20. Conflict of interest disclosure, I'm one of the co-authors of this one, stalking risk profile. There is a literature on these. It varies. The SAM, which is Steve Hart, Randy Kropp, that group that had the most research. In most of those studies, it doesn't predict future stalking. In 2, it does. In the 2 where it does, it has a modified application. Importantly, it only predicts same victim recidivism, not different victim recidivism, okay? HCR20, only 2 studies for stalking. Worked in one, didn't work in the other one. Different samples, different contexts. The Penny study, which is the Canadian Secure Forensic Mental Health, that's where it worked. It worked in that context. SRP, again, only 2 studies. Validity for future stalking in both. We've got another study at the moment that's currently we're working up, where we've looked at future stalking violence, and it seems to work for that as well, but we haven't finished doing the analysis yet. So this is the Treating Stalking book that Anthony mentioned at the start. There's a whole chapter in that book that is a really up-to-date review of the literature on these 3 tools. So I'd suggest if you're interested and want to know more, read those. The McEwan 2021 chapter also has a bit of discussion. It's just, there's a couple of papers obviously aren't referred to because they've come out since that chapter was written. Just remember, if you're using an SPJ approach to stalking, they predate a lot of the stalking literature, the risk factor literature. So they're not bad, but they don't have all the literature in them. And also just remember, risk factors are correlates. They're not causal. Don't assume risk factors are causing anything because they're probably not. So they don't have enough attention to the situation around the person. They're too individually focused. They're not focused enough on dynamic kind of factors that might be triggering, increases in stalking risk or violence risk. And they really don't help you formulate that much. Like they do to a degree, but you need to actually know and understand stalking to be able to assess it effectively, including to risk assess it effectively. So I'd really encourage you to read more widely than just your structured risk assessment tool, basically. I'm not going to go through that because I don't have time. It's really for people who are doing treatment, things you might be monitoring for in treatment that might be more dynamic. These are not in the risk assessment tools. These are things, but they are in that Treating Stalking book. We talk about these things. So just, I suppose, takeaways, risk is multifaceted. It's not just about physical violence. There is literature on this that we can turn to. It's not bad. It's not big, but it's not bad. The SPJ guidelines are good, right? They work. Okay, in a general sense, they're not bad, but don't think they're the be-all and end-all. You need to have a broader understanding of stalking to be able to apply them effectively and to think about stalking effectively. So make sure you've read an up-to-date review of risk factors and try to do some broader reading on stalking so you can understand and formulate in a really informed way. Which brings us to the end. Probably 3 things to take away. I probably said them all, so I won't repeat them. If you don't know much about stalking, use a typology, do some reading. It's complicated behaviour, but it's absolutely an understandable behaviour, and it's really interesting. You get all sorts of people who stalk, so it's quite fun, quite good fun to work with, and you get a wide range of presentations. A few recommended readings there if you just want to up your knowledge that you can access. That's the chapter I've referenced. This chapter here is quite decent as well. It's quite recent, has a good review. This is that theory paper that I mentioned. There's a couple here on management and treatment as well, which might be of interest. And that's the one about mental illness and mental health service use and stalking. And the other place you can go, I've already referenced this book. That's the Treating Stalking book. I'm not saying this to flog my book, but I'm saying it because it's the only thing that's really written in a detailed way on treating stalking. If you can access it without paying for it, go nuts, is my view. But in terms of actually understanding the work and understanding kind of what you need to be doing with this group, I think it's a decent resource. It was just published this year. And that is the end of the presentation. So thank you very much. I think I finished a couple of minutes for questions. Sorry, I went a bit long.
Well, thank you so much, Troy, for a very thorough and approachable look at all of this in terms of addressing and understanding stalking behavior. You can see that we have a number of questions here. People were very engaged, a lot of thoughtful questions here. In the meantime, as you can see on the screen, there is the QR code. The chat box includes the link to the APA survey as well, so you should have access to those now if you are seeking CEU credits. We did have a couple of questions that's centered on more motivation for stalking. Yep. One in particular here, somebody asked, what function does hacking accounts or impersonation serve in stalking behavior? Is it part of domination and isolation, or more a manner to make contact?
It can be a range of different things. So sometimes it's like monitoring. So hacking accounts allows people to know what's happening in that person's life. It can also be a way of damaging the person. So you're spending their money, you're, doing things to them. It can also be a way of doing reputational harm, because you hack account and then you send something to all their contacts that, naked photos or something like that. So it can be a range of different kinds of reasons for doing it. In my experience, it's usually either monitoring or it's kind of, intent. So you can do harm, like some sort of reputational harm or other harm to that person. Yeah.
In general, what's the most common motivation for stalking?
I actually can't answer the question, Ellen, because there isn't a way of answering that in a representative way, because of the different ways people present in different contexts. In a forensic context, it will be the rejected ex-partner. So they're either trying to resume the relationship or they're kind of taking revenge for the end of the relationship. That will be the most dominant group. 50, 60% at least of people in forensic context will fall into that group. But just remember, that's not stalking in general. Out in the world, probably, I'm guessing, incompetent suitor, people who are just kind of uselessly trying to get a date. I'm guessing that's pretty common, but they don't get to the threshold of getting to the criminal justice system.
Sure, thank you for that. We recently had a talk on here about incel behaviors, identity, and all that. And somebody did ask, is there a higher incidence of stalking incels?
There isn't a research-based answer to that question, Michael. I would suggest there probably is. Actually, in that chapter that I've referenced, the 2021 chapter, I actually talked specifically about that as a context in which you might be more likely to see stalking, because I think you're right. I think probably it would be expected, but there's no one that actually really looked at it. So I can't give a research-based answer.
Someone asked, you mentioned most stalking is not legally charged. Many clients trying to address stalking seem to have very mixed legal outcomes, seeking to redress for stalking. Aside from requiring legal consult, what do you think is a reasonable way to approach clients trying to determine whether or not to engage through the legal process that could aggravate stalking?
So this is kind of talking about kind of responding to people who are being stalked, so victims of stalking.
Yeah.
I think it's really vexed. I do think that there are cases where even though despite all the challenges of the criminal justice system and stalking, I still would say for a lot of people who are stalked, I still would say sometimes you just need to still do that, because even if it's not a stalking charge, often police can pursue a different charge and they will do that. And sometimes getting people into the criminal justice system is the only way to get them into an intervention that is going to have any effect on stopping them. So that coercive kind of intervention. So despite the problems with stalking charges, I would still, if there's really concern about risk to that person's physical well-being or perhaps their psychological harm is so severe, sometimes it's just you have to still do it. That said, there are ways of responding to stalking. There are civil injunctions. There are, victims can do all sorts of safety measures. Many victims move. I mean, it's terrible, but many victims move. They leave. It's awful. Like it's a shitty situation, fundamentally, and victims have too much put on them to manage it themselves. Yeah.
We are at the top of the hour. I want to be mindful of time, but thank you so much, Dr. McEwan, Troy, for, of course, again, first of all, for getting up. Minimal yawns here. Energy was on point here, so kudos to you for that. And also just the very engaging, approachable
communication for us for understanding critical issues related to stalking behaviors. So thank you so much.
No worries, Anthony. I will say if anyone didn't get a chance to have a question answered, I'm more than happy for you to shoot me an email. My email address is there. So feel free to flip me an email, and it might take me a little bit to get to it, but I can respond. So that's no worries.
Wonderful. Thank you so much for reaching out to our audience like that. And that wraps up this week's Law and Mental Health series. As a reminder, next week we have Dr. Terrell Taylor, who will be discussing how stigma of criminal legal involvement affects mental health and help-seeking behavior. We hope to see you then for another great discussion of issues in behavioral health and the law. Until next time.